Hi, I'm Jennifer Thomas from the Center for Behavioral Teratology at San Diego State University, and I'm going to be talking about alcohol's effects on the developing fetus. In other words, what happens when there's prenatal alcohol exposure? Prenatal alcohol exposure is a serious issue, as a majority of women of childbearing age drink alcohol. In fact, a fair number may be alcohol dependent or binge drinking, which may be particularly damaging to the fetus. And unfortunately, there's a lot of misinformation out there. So despite public health warnings, many women continue to drink while pregnant. Moreover, when you consider that almost half of pregnancies are unplanned, many women may be drinking, even heavily, before they're aware that they're pregnant. And even that early exposure has the potential to harm the fetus. So prenatal alcohol exposure is a serious public health concern. But what do we know? Well, we've known for almost 50 years that alcohol could disrupt development of the fetus. In the early 70s, Ken Jones and David Smith coined the term fetal alcohol syndrome to describe a collection of symptoms in children exposed to heavy amounts of prenatal alcohol. To be diagnosed with fetal alcohol syndrome, or FAS, there are 3 criteria. The first is a specific pattern of facial features as shown here, including an indistinct philtrum, which is that groove between the nose and the upper lip, flattened midface, and short palpebral fissures, these eye openings, and a host of other features as well. Secondly, pre- and postnatal growth deficiency, and then finally, evidence of central nervous system dysfunction. Of course, we now recognize that fetal alcohol syndrome is just the tip of the iceberg, and that many individuals may be exposed to alcohol prenatally, not meet the diagnostic criteria for fetal alcohol syndrome, but still suffer adverse effects. They may be diagnosed with partial FAS, alcohol-related neurodevelopmental disorders, or alcohol-related birth defects. And collectively, these are all referred to as fetal alcohol spectrum disorders, or FASD. So again, an individual may be exposed to alcohol prenatally, not meet the criteria for FAS, but still suffer from some consequences. And unfortunately, estimates of prevalence are quite alarming. Estimates vary around the globe, but if we look at estimates of prevalence in the United States, it's suggested that somewhere between 6 and 9 per 1,000 live births has fetal alcohol syndrome, and somewhere between 1 and 5% has a fetal alcohol spectrum disorder. In fact, the authors of this recent paper suggest that these estimates may be conservative and actually underestimate true prevalence. That means that fetal alcohol spectrum disorders are more prevalent than autism spectrum disorders, but they don't get as much of attention, in part because there's a lot of stigma associated with FASD, a challenge that we're still faced with today. So I mentioned that alcohol can affect the face. We're really more concerned with what's happening behind the face. What's happening with the brain? Brain development continues throughout pregnancy, so alcohol exposure at any time can disrupt brain development. Here's just an extreme example. These are brain scans in the mid-sagittal view, so if we look right down the middle of the brain and open it up. And on the left, we have a typically developing healthy 12-year-old male. You can see in this brain scan the cortex, the corpus callosum, which are fibers that connect the 2 halves of the brain together, the cerebellum, and the brain stem. And on the right is a brain scan of its age-matched individual with fetal alcohol syndrome. And you can visibly see that the corpus callosum is smaller and displaced. There's pathology in the cerebellum. And you can even see in the cortex, there are fewer wrinkles or folds. Now, in addition to there being alterations in brain structure, there may also be alterations in the connections among brain areas. Nerve cells communicate with one another via fibers, and many of these fibers are wrapped in what's called myelin that makes them white in a brain scan. So here you can see this corpus callosum. This is a cross section through these fibers going from one half of the brain to the other. And here you can actually see those fibers, where they go to. Compared to an individual with fetal alcohol spectrum disorder, you can see that there are fewer fibers and there's less organization. So that means that the connections among the nerve cells may not be functioning optimally. And if the brain isn't functioning optimally, that means there are going to be behavioral problems. And in fact, prenatal alcohol exposure can disrupt behavioral development in a number of domains, including executive functioning, which is the ability to plan and guide one's actions, attention, learning and memory. There may be specific problems with mathematical skills and motor functioning, dysregulation of stress, sleep, and mood, and also altered social processing and difficulty with adaptive behaviors. Adaptive behaviors are those that are necessary to live independently in one's home, work, and community. This includes things like communication skills, socialization, and just daily life skills, being able to organize and plan one's day, even maintaining one's safety, being aware of when there are dangers. So these may be particularly devastating for individuals who've been exposed to alcohol prenatally if they have problems with this in terms of having an independent life. Now, much of what we know about the effects of prenatal alcohol exposure on brain and behavioral development come from basic science studies or studies in children with fetal alcohol spectrum disorders. But children with FASD become adults with FASD. And it's only been in recent years that we've started to examine what the long-term consequences of prenatal alcohol exposure may be. What happens when individuals reach adulthood in terms of their behavioral challenges as well as their brain development. In addition, it's now recognized that prenatal alcohol exposure may affect lifespan health. This is consistent with the developmental origins of health and disease concept, or DOHAD concept, that exposure of the fetus to a suboptimal environment like prenatal alcohol causes adaptations that may help the fetus in the short term, but in the long term increases risk for developing some diseases. And in fact, there's accumulating evidence that prenatal exposure may affect long-term health, that it may compromise immune function and lead to increased risk for a number of health problems. So researchers are starting to investigate the effects of prenatal alcohol exposure on metabolic, cardiac, thyroid, kidney function, even autoimmune disorders, just to name a few. So if prenatal alcohol exposure affects physical development, brain development, behavioral development, health outcome, where do we go from here? Well, we have two primary goals. One is prevention. How can we prevent prenatal alcohol exposure? And the second is intervention. How can we intervene to improve outcome of individuals who've been exposed to alcohol prenatally? But there are a number of challenges that we have to face when trying to meet these goals. One is improving diagnosis, because there's not consensus about the different diagnostic criteria for the full range of fetal alcohol spectrum disorders. In part because it's difficult to identify those individuals who've been exposed to alcohol prenatally. For example, if you have a developmental disorder that's genetic in nature, there might be a genetic marker, so you can know that that's what the disorder's cause is. But what's the marker for prenatal alcohol exposure? We need biomarkers that provide some physical evidence of this. Biomarkers that are sensitive and can detect low levels of alcohol exposure, that are specific to alcohol, that can identify an individual as early as possible so that we can intervene as early as possible. And then finally, biomarkers may not only tell us about alcohol exposure per se, but may provide some information about outcome. So there may be biomarkers for alcohol-induced damage, which are just as important because they may help us identify individuals who may be at greatest risk for a poor outcome. There also are many challenges because there is so much variability in outcome. There are a lot of factors that can moderate risk for prenatal alcohol effects, including genetic factors, the dose of alcohol exposure, when the alcohol exposure occurred, what the pattern of drinking was, whether there's other drug use like cannabis, nicotine, or illicit drugs, maternal care factors, and even nutritional factors. So that's why it's so difficult to answer the very common question, well, how much is too much alcohol during pregnancy? Because there are so many factors that have an impact on risk for prenatal alcohol effects. But ultimately, our goal is to identify individuals who are affected early on so that we can intervene early on. And in fact, there's a lot of hope because there are behavioral or environmental treatments that can improve outcome in individuals with fetal alcohol spectrum disorders. For example, certain motor skill training that might improve motor skills as well as cognitive functioning. Some treatment programs that target cognitive and emotional regulation. Some that target specific domains like mathematics. So here you can see individuals with FASD who receive this mild training compared to those that did not. Even 6 months after training, there's improvement. And even social skills training. This is friendship training. And in yellow are the individuals with FASD who received this friendship training compared to those that did not. In addition, there may be nutritional interventions that can be effective. These are some data from a study that used supplementation of a particular nutrient, choline, in toddlers with FASD. And 4 years after the choline supplementation, we see improvement in a number of cognitive domains. So here we can see different cognitive functions. In yellow are the individuals with FASD who received choline supplementation compared to those that did not in red. And there are significant improvements, particularly in nonverbal IQ and working memory. So these data are all very promising and provide hope that we can, in fact, improve outcome. But we face another challenge, and that is how can we reach the many communities around the globe? How can we reach communities if they don't have the clinics, if they don't have the resources, the clinicians, if they're geographically inaccessible? And how can we overcome the stigma associated with fetal alcohol spectrum disorders? Well, the Collaborative Initiative on Fetal Alcohol Spectrum Disorders is currently developing a number of online or mobile tools for improving diagnosis and treatment. And this can help us overcome some of the barriers related to geography, stigma, and limited clinician availability. So again, these tools are currently under development. For example, we might be able to use 3D facial imaging for identifying facial features of prenatal alcohol exposure, where we capture a 3D image of a face and use a computer-generated algorithm to detect those features. Something that may be accomplished even with 3D imaging from a phone. We may also see the development of apps to improve diagnosis using physical and behavioral outcomes. Or in terms of treatment, this is one example, families moving forward as an intervention for caregivers raising children with FASD. It was developed by Heather Carmichael Olson, but Christy Petrenko has recently modified this, adapted it for a mobile platform. And so families who have children with FASD can access this information, and this may help improve outcome for both the child and improve family well-being. So in summary, what I've shown you is that prenatal alcohol exposure can lead to a range of physical, neuropathological, behavioral, and health outcomes. But we still face a number of challenges in the field in order to improve prevention, identification, and treatment for individuals with FASD. So I'd like to thank you for your attention. I'd like to thank NIAAA, who's funded much of this research. Some of it I showed you came from the CDC. I'd like to thank CFASD, the Consortium on Fetal Alcohol Spectrum Disorders, all the contributing researchers, Jeff Wozniak, and if you're interested in more information and services, please feel free to nofast.org. Thank you very much.